4208 215th Avenue, Fort East, Bonney Lake. My story about the health care can go back 50 years, but my husband got colon cancer, spent 6 years being tested, and then one day he had a heart attack and went into a heart doctor. And he felt the tumor had grown that much in those 6 years, and he was told to go to a cancer doctor, which he did, and they said they needed to operate immediately, and we had QualMed, and QualMed refused to give him permission to have it, saying that we would have to pay for the test and pay for the operation if it was done. Well, the cancer doctors went ahead and did the test and said that he was terminally ill, that he would have to go through chemotherapy. He might live a little while, but that was it. He died 6 to 8 months later. I get canceled on my insurance, and because of some mix-up in his company, I was supposed to have 6 months of it, but and then I could pick it up at a discount price. Well, I was canceled, and I was told that I was too old to get regular insurance and too young for Social Security. I had a car accident 4 days before Christmas, so I had to pay the stuff out of my pocket, and I didn't have medical, so I used up all my savings. And then I have another car accident where these are other people hitting me 10 months later, and there was more medical bills. I really didn't get it registered because a month later I was head-on. One was a rear end, one was a side collision, and one was a head-on. And on that one, I had an attorney for the first accident, got my medical, but I didn't get his payment, so I had to take a third of that to pay for the lawyer. That lawyer quit this law firm, and the law firm came back and said I had said I'd accept $20,000. I never signed a piece of paper or anything. Farmers Insurance, and that law firm came back and sued me. I went to the Bar Association. The Bar Association said that if I agreed to whatever their findings was, that would be it. The law in the state of Washington says you do not have to pay an attorney any kind of compensation if you don't have a signed contract, and I didn't for the last 2 accidents. I got $20,000 because the judge told me I had to accept that or I'd have to pay all the court costs that we went through in the courts. And then he quit. And through the hearings and stuff, I went to the Bar Association. The lawyer for them gave this attorney, and he was only supposed to get a third. He got $9,000 out of 20. I had to pay Medicare back $3,000. Well, no, I had to pay them the $20,000, whatever was left of the $20,000, plus another $3,000 afterwards. And I had $89,000 worth of medical bills that I got nothing out of. I refinanced my house and I got frauded over $270,000 and put in an adjustable mortgage, which because he owned the escrow company, I signed 2 contracts, one a fixed, which I thought I was getting, and an adjustable one.
Which they gave you.
Which he put through, and I was part of AmeriQuest, and I never even got a settlement out of AmeriQuest when they did the class action lawsuit. I dealt with the United States Attorney General, but I never got any of my medical bills paid, and now I may lose my house in foreclosure, all because I had car accidents.
That weren't your fault. Yeah.
That weren't my fault. These other people got citations for illegal driving. The last accident, which farmers said, and this is the biggest thing, is the insurance companies are frauding people every which way and back again. They said it was all pre-existing. My 11-year-old granddaughter probably has fibromyalgia from it, but the seatbelt she was bruised for the seatbelt. They hit me, pushed me 16 feet back up a hill. She went over the top of me, hit the guardrail, was parked 3 van lengths behind me, and farmers said I didn't get hurt in that accident. I'm supposed to have my knees rebuilt. My foot needs to be operated on. And I broke ribs in that, and my shoulder was
had a big old bump on it for a long time. My leg swelled up to 16 inches around. And because they sued me, I couldn't even get a doctor to treat me. I had to go to an acupuncture and spend out all kinds of more money on top of the $89,000. They need to do something about the healthcare system. And I'm going to tell you one other thing. I've talked to lots of Canadians, and they laugh at us because we say, oh, Canadian healthcare is bad. But they sit there and laugh at us because I had the accident. One guy says, oh, you should be fine. Well, a lady in the state of Washington sued farmers, and Canada is supposed to pay half of what any Canadian or American driver does up there, and so is the United States. The insurance are supposed to come here. She sued him and got her money out of it. Of course, they were taking her back to court not to get the money. But he told me I would have gotten a half of $300,000 in the Canadian courts. What's wrong with that?
Yeah.
And then he said he only had to pay $12 a month more to get full coverage on prescriptions. What's wrong with that? What is wrong? Tell us what's wrong with the Canadian insurance that they sit and laugh at us. I've had 3 people tell us, well, why don't you come to Canada and get their health insurance?
Yeah.
I would have had my legs fixed by now. I can't afford, and this is the other thing. I have ARP insurance. I pay Medicare. What is it, 80-some dollars, $90 a month? $95 a month. I pay $270 for ARP, but it only covers what Medicare covers. Anything else after that, I have to pay out of my pocket, and I don't have the money to pay to get my knees rebuilt. And I live in pain constantly. I sleep about 3 hours a night because I can't handle the pain. And something needs to be done. I have paid health insurance all my life, and I can't even, because of the way the Medicare pays out, because I've been healthy. Just 4 months ago, I started taking a prescription drug. I have paid $16 for prescriptions in 4 months, and I have to pay out $37 a month for the prescriptions. I could use that money to help me pay for something else. Yeah. I'm about to lose my home because they say they're going to do a foreclosure. I pay about $8,000 a year property taxes because I make a little bit too much. I can't get a senior discount. It's killing me. But when I had pains, because I had a whiplash, so the seven first vertebrae in my neck, and they wouldn't touch the first one because they said I might be paralyzed. I get pains. I get sharp shooting pain in my head. It starts from my neck and goes to my eye. I was having a series of these a year ago at Christmas time. So I wanted to go to a doctor, and I couldn't get a doctor. I have health insurance. I have Medicare, but I couldn't get a doctor because I didn't have a doctor on record. And when I said something, I said, I could be driving down the street and cause an accident. He says, go to the emergency room. Well, that's our problem. Everybody's going to the emergency room because they can't get health care. And then I finally, and I had gone into, because I fell at a business, and I went into the Good Sam outpatient thing. And even when I had this other shooting pains, they said I couldn't come in there because I didn't have a doctor. Well, when the doctor said yes, I could. But I was told I couldn't at that time. Well, I fell and sprained my ankle, and I had to go into, they went up here and they had to take me. And, but I couldn't get into a regular doctor because I wasn't a regular patient. Well, that isn't what their policy is, but that's what I got told. If we had a good health care and all the rules were the same, I wouldn't have been denied. And if I didn't have my Medicare and my ARP program, which I shouldn't even be paying for, I should be paying for all this other stuff that I need to get rid of that I was frauded, I would have had to pay $180 just for therapy after most of the plans only covered you for two visits in there. Then after that, and I was going 3 times a week because I sprained my ankle. And in the last 20 years, except for I had carpal tunnel, and then I had a knee surgery once, and then the car accidents, and this sprain. And I've had to pay for most all of it myself, except the last one when the sprain. But I do pay for it. I pay out $2,000 or $3,000 a year.
Yeah.
And I don't use it, but I can't get a doctor because I don't have a doctor that I regularly go to.
Go to. You don't have a GP. Yeah.
Right.
Yeah.
And it shouldn't be that way.
Yeah. Okay.
And that's my story.
Thank you very much, Shirley.